reopening the country, as most of Canada remains in the dark about when the economy will reopen. Saskatchewan has laid out a preliminary timeline of when some of its services will reopen, with some reopening to the public as early, apparently, as May 4th. To talk about this, Saskatchewan Premier Scott Moe joins us from Regina. Premier, first of all, good to see you. I hope you and your family are well in the midst of this crisis. How did you arrive at the date May 4th?
Well, we worked collaboratively with our Chief Medical Health Officer here, Dr. Shahab in Saskatchewan, as well as our Ministry of Health and our Saskatchewan Health Authority, as well as our business community, and identifying what our business community is already doing. And it's important for us to recognize that there's been many businesses that have been open throughout this pandemic, and they have gone above and beyond, in many cases, what the expectations are to ensure that they are providing a safe environment, not only for their staff, but also for their customers. So we have arrived at May 4th as a date to open some of our services here in the province. May the 19th, we will move into phase 2, and we will utilize our aggressive testing and contact tracing to determine dates for additional phases.
Premier, I thought you said it really well today when you said this is not flicking a light switch on and off. This is like using a dimmer. Can you walk us through the 5 steps? How would this work? Who gets to go back? Schools, businesses? You know, what are these 5 phases?
Sure. The first thing we need to understand is we do need to keep our most vulnerable citizens safe. We know that travel has been a cause for early stage infections, so travel restrictions will remain in place, as will restrictions around large gatherings, and ultimately the restrictions into our long-term care homes and our seniors care facilities here in the province. We've actually ramped up those restrictions in the last week. Phase 1 will allow some of services that are somewhat healthcare related, dentists, opticians, optometry services, as well as some chiropractic services to be provided. Phase 2 will get into our retail sector. Phase 3 is where we will start to look at increasing ever so slightly some of the gathering sizes, things of that nature, and then on to 4 and 5. Phase 1 and 2, as I said, have been identified dates to open those phases in May the 4th on 1 and May the 19th on phase 2. Any future dates for phase 3, 4, and 5, those will be in close consultation with our public health officials to ensure that what is happening with our testing and with our positive ID rates is not out of what could be expected.
Premier, I've just heard that the Calgary Stampede has now just been canceled. You're going to be saying golf courses are going to be reopening May 15th. I'm just trying to figure this out when people are moving between provinces. If you're opening golf courses and Alberta's canceling the Stampede, how do you avoid a second wave?
Very, very different events. Our golf courses will not be open as they were last year. There's a number of physical distancing measures that need to be put in place to ensure that they are operating very, very safely. Calgary Stampede, other large events with many thousands of people are quite different than 4 people going out in separate carts or walking on a golf course, ensuring that they are not touching the same items at the same time. So what we have tried to do is run the balance between the services that people can enjoy as families, the businesses that are available, and ensuring that we are not increasing the risk to any large degree of this virus being contracted.
Premier Moe, just before I let you go, do you think that the rest of the country should follow this example? I just wondered, do you think it should be provinces make their own choices, or should there be a coordinated sort of 5-step program? You have one, maybe the federal government should have one, or not. What do you think?
The collaboration is happening between the provinces. I was on a call again today. Every week, the premiers talk as a Council of Federation on just where we are, recognizing we're in very different stages, if you will, of how this pandemic has affected our communities and what toll it has taken on each of our communities in our respective regions. So it needs to be the provinces that take the steps in collaboration, not only with one another, but in collaboration with our federal government. In Saskatchewan, for instance, we have 40% above the national testing rate. Even with that, we're 70% below national infection rate. And when it comes to serious incidents like death and hospitalizations, we're 90% below. So the situation in Saskatchewan is very different than some other areas. That needs to be respected, and provinces are the place to remove these restrictions as they see fit, as the provinces are the place where these restrictions were actually enacted. But that is happening in very close consult with one another and in close consult with the federal government. So it's a collaborative effort, but it is the provincial jurisdiction.
All right, I got to leave it there. Premier Moe, always good to have you on the program. So Saskatchewan Premier Scott Moe in Regina saying we've got a plan to open up that